If you're doing IVF, you're made of hard stuff because you've been through shit to get there.
I remember a patient once telling me that she kept crying in the middle aisle at Tesco, and I was like, it's the drug.
The egg collection day, it's kind of like getting your exam results, isn't it? Because you don't know how you've done.
When we talk about large numbers of eggs, it's really important about quality, not quantity.
It was jam-packed down there, that's for sure. It was one to add to like the bingo card of IVF and trying to conceive. Can't wait for that.
Everything comes back to these two things, which are trust your team and everyone is different. You're listening to the Too Much Information podcast, where no women's health topic is off limits. Before we get started, I just want to say thank you. This podcast would be nothing without you. Follow along if you're not already, and if you like what you hear, please spread the word. Enjoy the episode. Hello, and welcome to this episode of Too Much Information. Today, we are talking all about what to expect from IVF. Even though we're talking specifically about IVF, a lot of what we talk about today is going to be really relevant to people who are going through an egg collection. That might be that you're freezing your eggs, that you're donating your eggs. This is not a protocol walkthrough, so if that's what you're expecting, that's not what today's about. What we're aiming to do today is to give you some of the insight on what to expect that you might not be given by clinics or find online. And to do that, I've got two women here who have very much lived this. First of all, inviting back to the podcast for the third time, so delighted to have Fran Steyn here, an amazing award-winning fertility nurse and friend, and someone who has just been incredible over the past year or so for me personally. So thank you, Fran. It's so nice to have you back.
Thank you for having me, and you're welcome anytime.
And then for the first time, Annabel Gammack, who is a fellow podcaster and founder and host of the Am I Overreacting podcast. What a great name. But yeah, it's such a pleasure to meet and to have you here.
Thank you so much for having me. I'm so excited.
I know firsthand, as somebody who is going through this for the first time currently, that sometimes there is such a thing as too much information because every single experience seems to be completely unique. And I just want to caveat everything that we say today with that. If this is something that you're preparing for, there is a chance that you might relate to some of it, but that you probably won't relate to absolutely all of it. Fran and Annabel, I'd love you guys to introduce yourselves. Fran, do you want to go first and just remind everyone what it is that you do day to day, but also how you know this topic very well, both professionally and personally?
I'm a fertility nurse. I've been a fertility nurse for about 20 years now, and I've worked across the NHS and the private sector in clinics. I've also worked in digital organisations, so delivering remote care, and looked after lots of different people from the LGBTQ community on surrogacy journeys and things like that. So I have been doing this a long time. So I've got a lot of professional experience in supporting people, going through fertility treatment on a fertility journey. But I've got two children now who are 9 and 12. Before I had them, I had 3 miscarriages, and I thought I'd need IVF. So, a lot of what I do day to day and have done in the past is because I've put myself in the position of my patients, because I do have that understanding. But I have also donated my eggs, so I am an egg donor. So I have had an egg collection. I know how that feels, and I know what it feels like to inject yourself daily. So hopefully I can help and share some information from that side of things too.
Yeah, that's amazing, Fran. Thank you so much. Annabel, would you like to introduce yourself?
Yes, so I'm Annabel. I'm an IVF patient. My husband and I have been trying to conceive for 8 years now, and we're in our this will be our 4th year of IVF. We've done 3 egg collections and 2 embryo transfers, and we've currently got a few embryos in the freezer. And it was probably about 5 or 6 years ago that I started speaking about it all online, and just as an outlet for myself, which has now turned into co-hosting a podcast as well. And yeah, that's me, I guess, in a bit of a nutshell.
Thank you both so much for being here. And yeah, it's just amazing to have two different people with completely different experiences. What I'm hoping that we can do today is walk through every step, from some lovely pills to delay your period right up to egg collection and the days immediately following it. We're going to save the embryo transfer part probably for another podcast, but throughout it, Fran, Annabel, we will discuss physical and emotional symptoms, your experiences, maybe some of the TMI moments, and then also those practical tips and coping mechanisms that people can take on. Does that sound okay?
Yeah.
Yep.
Okay. Shall we start with those days leading up to when you first start your medication? Because I don't know how either of you felt about this. I suppose maybe there's a different weighting to it when you are going through this procedure to try and have a baby, which you've been trying for some time. One thing that I was absolutely not expecting was that final fertile period or fertile window that I had before I started my medication, where you're not allowed to try. You have to use protection. It was a complete head fuck. I didn't know what was happening. I could feel my body telling me that it was ovulating, and I was just filled with self-doubt. Annabel, can you relate at all to this?
Yeah, and I think it's so hard to get your head around that shift from, right, I'm gonna have sex to have a baby, like I really want to try and get pregnant, to no, I cannot get pregnant now. And it is a real, like you say, a bit of a head fuck, because you're going against everything that you are trying to do in order to go and do something to try and have a baby. And you're like, well, I'll keep having sex because that seems to be the thing that works for everyone else. So surely if I just keep trying, and there's always that thing of like, maybe this time, what if this month would have been the month that this would work?
Yes.
So yeah, I do definitely like remember that kind of, like you say, it was self-doubt. And I think for me, the whole concept of starting IVF, it took ages to sink in. Even once we knew we were doing it and we were told this is the route you need to go down, I still didn't really accept it, I don't think, until that sort of time of then like, okay, now we're in the cycle where we're actually going to start the meds. And yeah, I think mentally it can be really difficult to accept and wrap your head around.
Yeah. A lot of people don't even want to say the words.
Yeah. Yeah. I remember the first time we drove up to the clinic, I cried because it wasn't so much, I don't know, it was just a really weird feeling of, oh my gosh, okay, this is real now. I remember the first time kind of, I was excited and I was like, oh my gosh, this is it. We're finally here. Like the bit that we've been waiting for and working towards for so long. And the past two egg collections since then, it's been a whole different feeling, like waiting to go on norethistérone to delay the period, because it's a bitch, that one. It really is. There's no kind of easing gently into it. I kind of thought, oh, this is the easy bit. Like you take the pill for a couple of weeks and that's fine. But no, it is a real, throws you in the deep end, that one, I think.
I think there's an element here of, well, you've been on autopilot for so long, trying to get pregnant every month and having sex on, when you're ovulating, and now you can't, and you've lost control of that situation and you're now putting all of your trust, hope, and everything into a complete stranger. So that is a really daunting aspect.
Yeah. And I also think people, just from an outward perspective, everyone associates IVF with the injections. They don't, when they say, oh, how are your injections going? And I go, no, I'm actually taking this pill to delay my period. That feels quite routine. Fran, can you explain why do we take the norethistérone?
Northisterone is a progesterone pill. We often prescribe that to delay your period so that you don't have a period on your holiday or something like that. The whole thing with northisterone, and it's not just northisterone, sometimes there's another drug called Provera, which does the same sort of thing, and the contraceptive pills. Some clinics and doctors will use that to so what they're doing is they're taking control of the cycle. It is just that we need to manipulate your cycle, and to get you to bleed when we need you to bleed, so we can calculate when you're going to start the injection, the stimulation medication. But it's to take control of the cycle, that control away from you, really. Which
Wow.
sounds horrible, but we have to do it so that we know when things are going to happen.
My doctor once said to me, he was like, what you need to understand is that your body is no longer yours. He was like, your body is ours now. And that was a really like jarring thing to hear. But then I think it's helped me so much moving forwards, like with every treatment, because it's like, you just have to put your trust in them. I don't know what is going on. I don't know what I'm putting in my body, but I just have to trust that this is the right thing and someone else is looking after what's going on from afar.
Yeah, and that is one of the key things. You need to feel that you're being well looked after and comfortable and open so that you can ask the questions and they'll give you the response that you need. And actually, it's not always the response that we want, but you want it delivered in a compassionate and caring way, and you want to feel looked after.
Annabel, have you been at the same clinic for the multiple cycles that you've done?
No, we were at a different clinic for our first cycle. And that did not go very well. And after that, we were like, right, we need to go somewhere else because, there were multiple things that happened that we weren't happy with. And I knew that ultimately I wouldn't trust them. And if I didn't trust them, then I knew that the whole process, I'd be doubting every single step that we made. We moved after that and we've been with the same clinic since then. It's so important to be with a clinic that you trust.
Can we talk a little bit about how you felt, both of you, if and when you were taking these medications, these pills to delay your period before you start your IVF stims? So I've got some messages in from listeners here. Hot flushes, rage, headaches, nausea. Any of this relating to you?
Oh, yeah, 100%. Every single one of those.
I've been doing a lot of crying, like crying at random things, like TV adverts.
Mm, mm. I remember, I think for me, the biggest one was the brain fog. I remember my husband looking at me and I could see him watching me. And I looked at him and I was like, what is it? And he was like, you have just been staring off into the distance for so long. And he's like, I have no idea what's going on in your head. And I thought, absolutely nothing. Nothing is going through my head. Like, I don't even know what was going on just then. Like, I couldn't concentrate on things at all. Also the hot flushes and the nausea and not being able to sleep. But then you can't have loads of caffeine because you've got to cut out the caffeine.
Yeah, no, the feeling really tired but not being able to sleep is a real double punch, isn't it? You're like, why? That's horrible. Fran, why is it that we feel like this?
It's basically we've been given a synthetic hormone to take, So, it's progesterone for a start. So those symptoms are all, expected, in bloating as well, and yeah, so that's a big one. So I had to take this drug as well for when I donated my eggs. I'm not very good with progesterone anyway and things, but it was just it was rage. It's exactly like that. Rage 1 minute, crying the next. So it is the drug that is doing that to us. It is a major, hormone disruptor, if you like, and giving us that synthetic progesterone. It's going to cause all these problems. And actually,
Yeah.
I think sometimes northisterone is probably worse than the injections. I remember a patient once telling me that she kept crying in the middle aisle at Tesco. And I was like, it's the drug. There is nothing wrong with you. It is the drug, And so it does do that. It is basically disrupting our hormones.
I got in a real grunt this weekend because I had 2 baskets of washing that I knew I had to fold and put away. And I kept walking past them and they were just putting me in a worse and worse and worse mood. Yeah, I don't think it was the washing. So can we talk about what happens when you actually, because what you end up doing is, I mean, what I've got is like a 5-day break between I take my last pill and then I've got about 5 days until I start my injections. And during that time, I'm expected to get my period. Some people have said that that's not a very nice period.
I can't remember them being particularly bad, the period after the norethistone. I was always then nervous about the baseline scan, I don't want to jump ahead, but I was always like, oh, I don't know how I feel about having the scan while I'm on my period. But I don't remember being particularly like heavy when I had that done. So I think mine have always been okay.
Okay, that's good to know. What about you, Fran? Do you remember or do you know anecdotally from others?
Well, anecdotally, I think I think it's, comes down to the fact that it's different for everyone. It depends how your body responds to it. It can be quite painful and crampy, though. I think, just to be aware of that. Clinically, not progesterone can cause a heavy bleed. So if it is quite heavy, try not to be too concerned because it is probably down to the progesterone, especially if you've been on it for a might period of time, because some clinics ask you to take it for 14, 15, 16 days to fit with their egg collection times, which is completely fine. But the longer you're on it, it's quite likely the heavier the bleed will be.
Yeah. Okay. That's really interesting. Next stage then. Annabel, you mentioned a baseline scan, which I don't have. So that in itself is interesting because it shows how different each protocol can be. Fran, what's normal at this stage?
So it is very much down to protocol. So most clinics, well, a lot of clinics will ask you to call them when you get your bleed, and then you come in for a baseline scan between day 1 and 3 of the bleed. And what they want to check for is that the northistone's done its job, the lining of your womb is thin, and that there's no activity or cysts in your ovaries, so that you can start the stimulation meds. Now, not all clinics will do that. And it does depend on what protocol you're on. So if you are on a long protocol, and I'm probably jumping ahead now, and you've been asked to take something called Buserelin or Supercure, then you will just start that. They'll say start that when you get your bleed, and then call us and we'll get you booked in. But some clinics just ask you to start the stimulation drugs on day 2 of the cycle anyway, and then they might bring you back on day 5 or 6 for a scan to check the response, and then add in another drug. But there's no right or wrong answer here. It's just different protocols. And there's so many protocols out there. A lot of people just think there's long and short, but there's all sorts, with little tweaks and troughs in them that have worked well for those clinics and given them good success with patients. There's no right or wrong. It's what your protocol and what your clinical team have decided on.
Yeah. And again, it comes down to that trust, doesn't it? So when we start the injections, I feel like this is the bit that a lot of people associate with being the scary part, maybe because it is this kind of hurdle of injecting yourself. But interestingly, I've taken down a few quotes that I got from listeners here. Someone said the injections are probably the easiest part once you get over the first few. Someone said injections were tiny, way easier than I thought. And someone else said taking back some sort of control is often just the mental boost you need, which I thought was really interesting. Annabel, I would love to know how you have found this stage.
I completely agree. Like, particularly with the one about taking back control. My friend Amber, who I do the podcast with, she said that to me before I did my first injections. She said there is an element of control actually that's really, really nice. And you feel like you're doing something proactive. It's kind of like how I felt it was the IVF version of tracking your ovulation. Like when you're tracking your ovulation, you're trying to find some element of your control and you're like, right, what can I do here to help this and improve my chances? To me, the injections are the IVF answer to that. I don't love doing them, but the stims, I didn't find an issue at all. I think they definitely seem a lot scarier than they are, but I don't think they're something that you need to worry about. If you're doing IVF, you're made of hard stuff because you've been through shit to get there. So you can handle some injections.
I love that, Annabel. Are there things that you've done that have made them easier or really less painful?
I don't know. Like, I always kind of just do it as a little sort of like smiley face underneath like my belly button, like just kind of make my way around, and then just so I'm not injecting the exact same place like day after day. But the needles are so thin and they're so fine.
They are
Fran,
tiny,
you're
aren't
nodding
they?
along. You're like, yeah, they're tiny. They are. They're tiny. So it's, to me, they look a bit daunting with like the mixing needles. I remember when I got my medication delivery and I looked at the needles that you use to mix the stuff together and I thought, that is not going anywhere near me. Like, cancel the whole thing. I'm tapping out. But then when I realized, no, you change the needle to like the thin one to actually inject it. Yeah, it's fine. I never needed personally to use anything like ice packs or anything like that. People do, but I never needed to.
Fran, what about you? Do you have any other tips?
I mean, I think the injections themselves, you're right, it is an element of control, but also you get that little bit of high again because you've been suppressed with northisterone. So then you're getting some synthetic estrogen and stuff, so it makes you feel a bit happier. I think the other thing to mention is as well is that it also helps partners because they often feel like they're not involved and they can't help, but with injections they can. I mean, I would not let my husband inject me because he's got, he doesn't like needles for a start, and I'm sure he'd just do it on purpose to hurt me, but no, he wouldn't. But, it is a way of involving your partner as well because they do feel helpless and they do feel that they can't support you, and especially if it's a male partner because they feel like they've only got one small part, but um, these sort of things can really help but some of the drugs, I mean, they shouldn't hurt. They are like pediatric needles. They're tiny, tiny. But when you've been injecting every day for quite some time, you can run out of space. And I mean, especially if you're quite slim, it can be quite uncomfortable. But so, I mean, if you do find that it's getting a bit stingy and stuff, just use an ice cube, put an ice cube on it first, just to numb it. The other thing I should say is that if you are on a short protocol, an antagonist, then and you've been prescribed Cetrotide or Ganirelix, which is a similar drug, it's an antagonist. That can sting a bit. So you often find that you might have a little bit of a red area or rash after you've injected. Don't panic. It's quite normal. Everyone gets it pretty much. But it's, again, something that clinics forget to tell people. So you often get people thinking, I've got a rash, I've reacted to the drug, when it's not. It's just probably because a droplet has gone on the skin, on the outside of the skin. But yeah, I mean, again, if it is, just put a bit of an ice pack on it if you need to. I mean, Annabel said she didn't really need to. Not many people do.
Someone that I was talking to yesterday said that they'd found breathing exercises really helpful for it. Not even necessarily for the pain, but just for almost having a cue for when, I think it was their partner who was injecting, they would breathe in and then hold at the top. And holding your breath, I think, does minimize some pain receptors as well. So there's some science in that. And when they were holding, they would give a little nod, then the injection, and then they would exhale as it was being released, which sounded all right. Might give that a go. I'll let you know if I do. Can we then talk about that the week before your egg collection? And some people have mentioned the fact that when they were on just one injection a day, that was manageable and they actually felt completely okay. But when they went up to multiple, that's when they started to feel not great. And people have definitely spoken about bloating, weight gain. Somebody messaged saying, no one told me how much my body would change through all this. It's hard feeling uncomfortable in my own body before I've even gotten pregnant, which, yeah, it does feel slightly unfair. Annabel, how did you find that kind of how have you found that grisly end before egg collection?
My perspective on this is probably slightly skewed. So our first round of IVF was cancelled after egg collection because we didn't retrieve many eggs and none of them fertilized. And I felt fine throughout that. I didn't really feel bloated. I didn't feel particularly sick or unwell. I had a bit of brain fog, but generally I felt okay. And so since then, when we moved clinics and our protocol changed, so the past 2 egg collections that I've had, I love feeling shit. Like, because to me, the worse that I feel as we approach egg collection, the more I feel reassured that something is happening. And I know that, I mean, don't get me wrong, I still complain to my husband a lot when we're in it, and I'm like, oh my God,
Naturally.
like, it's elasticated waistbands only. It's, I do still feel sore and uncomfortable, but to me, it's actually a real source of comfort. Um, so yeah, I probably am the wrong person to ask about how it feels, because to me, I'm like, bring it on, please, just make me feel awful, because the worse I feel, the more confident I feel.
Oh, I I completely get that though. Fran, is there truth in that as well?
Well, I guess so in a way, because if you are stimulating, your ovaries are swelling. You are producing. Your follicles are growing. So follicles, fluid-filled sacs that contain our eggs. So they're growing, they're expanding, they're pushing everything. So you are feeling uncomfortable. Often people have said to me they feel like everything is stuck up here, because everything is pushing. Um, so yes, in a way. So if you're responding to the medication, then you are going to feel crap like that. And you know dehydrated, which is why we constantly tell everyone, right, drink plenty of water, at least 3 liters of water a day. And lots of patients say, I can't. No, you've got to, because you are also an element of you're gonna come a little dehydrated, because your ovaries are swelling and filled with fluid.
Wow.
All of your fluid is going to that part of your body, to the pelvic cavity, to your ovaries. So naturally, you are going to be quite dehydrated. So this is why we keep on top of the fluids, and it will help maintain the fluid balance throughout your body. Um, but obviously, there is also something that is quite serious, and as a result of IVF, is a ovarian hyperstimulation syndrome, or OHSS. So the worse you feel, the more at risk you are of OHSS.
Mm.
Um, Now, we try to do everything within our power to stop you from getting OHSS, because it can be quite serious. But it's basically when your ovaries over respond and you become quite unwell, bloated, and you produce many, many follicles. Um, but it can make you feel very unwell. So that's what we don't want. We expect you to feel discomfort and unwell because of the nature of what you're going through, but we don't want it to be on that side of the scheme, really, of OHSS, because it's not good. And then sometimes you end up not being able to have a fresh transfer because you're so unwell. You have to freeze
Yeah.
everything.
Annabel, I can see you nodding along there. Have you had experience of OHSS?
Yeah, in our last round, which we did in December, and I'd had a conversation with my consultant, and I was like, please just push me as far as you can push me, because I'm fed up, and I
Mm.
want to get some good results.
Yeah.
And they were really good. I was being monitored and tracked. Everything was looking fine. I had a lot of follicles. It wasn't until after egg collection that then I started showing signs of OHSS. Um, and that was not fun. That was
Yeah.
a pretty nasty week. But fine now. And I didn't have to be hospitalized or anything like that. So it was, yeah, in the scheme of OHSS, it was okay.
That's good. That's so brave of you to, I mean, to know what you wanted and to kind of really advocate for yourself in that situation. Should we just talk a bit about what are the warning signs where you should be reaching out to your clinic?
So, I mean, it normally, as Annabelle said, it normally will kick in after you've had the trigger injection. The main symptoms really of OHSS are bloating. Bloating is the big one. Headaches. Then you get, things like difficult to go to the toilet, so both ends, so you can't pass urine, you can't open your bowels.
Wow.
Difficulty breathing. Sometimes people find that they were going up the stairs and thinking, I can't breathe, what's going on? Those are signs of OHSS. But the big ones are bloating and swelling. So if you start feeling like that straight away, then you need to let the clinic know.
Is some level of bloating to be expected at that point?
Yeah, definitely. But it's when it becomes very painful, and you'll
Right.
know, I mean, it is uncomfortable, but if it's becoming really painful and you're doubled over in pain,
Mm.
um, and you feel like, the whole torso is like the shape of a potato, I guess, because all of you is like, that is when, something's not right.
Okay. Yeah.
Lots of people don't know until they've had the egg collection. And
Yeah.
then you think, "All right, I'll start to feel better now," but then that's when it really hits.
Interesting. So you want to be ideally feeling better after your egg collection rather than worse. Just before we move on, got a couple of questions from listeners. One said, what kind of exercise is safe during your IVF stims?
That is a good question. I mean, you can exercise, but, you can't be running marathons or anything like that. I would say that anything that's like high intensity, you need to stop.
Mm.
You just need to be doing gentle exercise. Walking, a little bit of jogging is fine. Swimming if you know, do swim, but then you have to listen to what the clinic says, because sometimes they don't want you swimming in chlorinated waters and things like that because of infection risks. So, but I think just do what you feel comfortable doing, and you will not feel comfortable doing any of that, because you will be bloated and tired. You'll be bloody exhausted, and just so if you feel like you just need to sit on the sofa and lie and, eat chocolate, do it. And I know it's not a great thing to say because of what everyone's going to, but you do need to get into that sort of mindset of treating your body like that you are early pregnant, so that you've got to be careful of your pelvic cavity, careful of your womb, careful of your ovaries. So no ab crunchies or anything like that.
Good advice. And the other question, someone said, does being super careful about nutrition really make a difference at that time?
No. I've just told people to eat chocolate. So,
Yeah.
look, if you're going to be, if you're really unhealthy and have a really unhealthy diet anyway, that's not ideal. But, would all say just try and eat well and drink well. You need to stay hydrated, eat lots of fruit and veg, get your protein in. But if you have, a bar of chocolate or some sweets because you feel like you need the sugar, or you just need something because you're tearing your hair out with emotion and if things like that, just do it. It's
Mm.
not going to it's not going to stop the treatment from working. And actually, there is a lot of data to show that if you restrict yourself, that can do more damage because, it's stressful and you're already going through a hell of a lot. So, you don't need to restrict yourself. You just need to eat and drink well.
One of the things that I had, particularly on norethistérone, but then carried on throughout, I had such strong food aversions, particularly to fruit and veg. And so my husband would make, because he's the cook in our house, he would make these like delicious meals, and all I wanted was beige food. Yeah, I'm glad that you've said that, Fran, because it does make me feel a little bit less less guilty about my food choices during cycles.
You know what? As I said, the stress of everything, the whole situation that you're in, eat the beige food. I mean, lots of people would take preconception supplements anyway. You've got your vitamins and stuff going on there. It's not going to cause you, unless, I mean, if you're drinking a bottle of vodka a day while you're doing your IVF, yes, it's going to cause a problem, but no one would do that. But just, it's all about looking after yourself and
Yeah.
making sure that you feel, and most importantly, mentally okay, because it's a lot. It takes over your life. So eat the chocolate, eat the beige food.
On the topic of a bottle of vodka a day, where do we stand on drinking?
So alcohol should not be consumed whilst pregnant. We all know that. But, you know, and goes back to like restricting. If you have a glass of wine with your husband on a Friday night while you're taking stims, it is not going to stop you from having a successful treatment cycle. If you completely restrict yourself, and that's often the way people unwind a bit as well. So you need to if you do unwind that way with a glass of wine on a Friday night, do it. Don't do it, on the day of the egg collection, because you'll have had sedation and, who knows what will happen. But, and don't when you're pregnant, because we just shouldn't. I've never told any of my patients to restrict like that, because A, there's no evidence to support it will do anything to you. And B, I much prefer, people to, have some sort of normality in their life and some sort of control again when they're going
Yeah.
through this whole of, the journey.
Thank you, Fran, for keeping it real.
You'll always find me doing that.
So should we talk about egg collection day? Annabel, do you want to walk us through what has this looked like for you?
Um, it's a bit of a mixed bag. I mean, ultimately, it's been a mixed bag because of depending on the result from egg collection. My first clinic, I went through to a sort of communal waiting room, and I was placed in like this weird sort of armchair while someone else was opposite me in a bed, and I was very jealous that they got a bed and I had to sit in this armchair. Um, and then my other clinic, it's all just everyone's the same. But then in both those cases, my husband hasn't been able to come with me into that room. And I know in other clinics, sometimes they let the partner go in. They have photos with their partner kind of while they're waiting to go in for their egg collection. Whereas I've always just been called through and sort of waved goodbye to Matt and then text him when I come back round. But I mean, the sedation part is great. That's good fun. The best one was probably the second one, I think, because we went from having a cancelled round. So I was comparing it to that experience, and the second experience was so much better. And I felt so much more looked after and cared for. And then the last time we went, I think I was expecting so many more eggs than what we got. So I immediately felt deflated. But to me, the egg collection day is always, I don't know, it's kind of like getting your exam results, isn't it? Because you don't know how you've done. The scans can say one thing, and then it's not until you kind of come round and then they tell you how well you did, until you realise. The first one was hard because I knew that we got 5 eggs, which I know for some people is a really good amount, but it was less than we were expecting. And like I say, it was like a weird sort of communal room, and the woman in this bed, you know, because she was obviously special, so she got the bed, and they'd got 22 eggs from her. And all of the sort of nurses kept going up to her and congratulating her and, oh my God, that's so amazing. And I was just left to sit in this chair on my own. And I felt like such a failure after that. It was
That sounds
awful.
awful.
But then since then, it's been fine. So I think it's so sort of clinic dependent. But yeah, the sedation's good. The sedation's the fun part.
Gosh, I'm sorry that you went through that. That makes me feel terrible as a nurse. I feel
Thank
like,
you.
I just think that that is not the way to treat people.
It's okay. We changed clinics. It's fine.
What's actually happening on that day, Fran?
It's different clinic to clinic, really, but most clinics now you'll have conscious sedation that's either administered by a nurse that is, you know, trained to give sedation, or an anaesthetist. Actually, I mean, so I'm sorry to be graphic here, and I know that Annabel, you've been through this. Issy, you're going to go through this, but
That's
we
okay.
are
That's what this is about.
putting a needle about that length inside your ovaries, and we're piercing. Although we're piercing the ovary, so we're going up through the vaginal wall and piercing the ovary to extract the follicular fluid which contains your eggs. So it's a tiny, tiny incision, really. So you won't need stitches or anything like that. But it is a procedure. It is a surgical procedure. So when people refer to an egg collection, oh, it's just, you know, it's only half an hour. It's surgery. You're having a gynae surgery procedure, because we are, you know, going through the vaginal wall into the ovary with the needle to extract. So it is painful. It is going to be painful, which is why most clinics will give you conscious sedation. So it's not a full-on general anaesthetic, although some clinics do still do that, actually. But you'll be asleep and you should be feeling any of it. What you'll, a lot of people wake up thinking, you know, has it happened? Have you done it yet? Which is often, as that's how I felt actually when I had an egg collection. I wasn't even aware that, you know, I was like, when are you doing it? But I do have to say this every time, as soon as someone wakes up, you know, I think in every egg collection I've been in, the first question is, how many eggs did you get? How many eggs did you get? You know, because you go to sleep thinking about that, and then you wake up thinking straight away, you know, have you done it yet? How many eggs? And that's normal. But it is. We're sedating you. You shouldn't feel anything. You will feel uncomfortable. You might wake up feeling like you've got a bit of cramping and period pain. You might have a bit of spotting and blood loss, because again, we are piercing the vaginal wall and the ovary. But you shouldn't be in too much pain or discomfort. One, because you've got the medication on board that we've administered. But during that time, what usually is happening is you're in theatre, and it depends in the clinic setup, but you're in theatre and your partner's produces sample. As soon as the eggs are collected, they'll go into the incubator, keep them warm, and then they'll start doing either IVF or Issy to create your embryos. Often, sometimes clinics will, like when you go straight into theatre, take your partner to do his bit so that if he is allowed into recovery or into the prep area, like some clinics do, so that he's back from when you wake up, he or she back from when you wake up. But something I do want to say is that, when we talk about large numbers of eggs, it's really important about quality, not quantity,
Yeah.
because someone who's got 30 eggs, he's probably got OHSS, and that would potentially mean that their egg quality is not going to be as good as someone who's got 12 eggs. So, because there'll be a lot of immature eggs and which you can't fertilize. So just, try not to be too head up on if, I want 20 eggs, because it's probably not the best thing to be happening, actually.
How have you felt once you've had the results of the amount of eggs collected after each one? How have you like dealt with those feelings?
I think I'm very much a planner. So if I'm given bad news, my mind instantly goes on to, okay, so what's the plan? Um, so when we found out that we got the 5 eggs, I kind of was just like, that's it, the round's over. And I know that, you know, for a lot of people, 5 eggs is a really good amount. But for us, we knew that that was less than they were expecting. And so I just felt immediately, completely disheartened with it. And I remember sobbing to Matt that night because that was our NHS round. And
Yeah.
I just thought, this is it, it's over. And he was very much like, no, it's not over until it's over. And then the next day I got the phone call from the clinic to tell me it's over. And I had a bit of a cry, but at that point I was fine because I had already accepted it. And I think it took Matt a little bit longer to accept that one.
Yeah.
The second egg collection, we got 11 eggs, which was a lot more than we'd got previously. So we were absolutely over the moon. And then our most recent round, we got 12 eggs, which was again more than we got previously, but was far fewer than what they were expecting
Yeah.
based on how many follicles I had. So again, I was devastated, but it was the most eggs that I'd ever got. So it's such a roller coaster. And I think the way I kind of deal with it is I kind of let my emotions just land wherever they need to land. Because once I've cried, once I've, complained about how unfair it all is, then I can just move on to the next stage. But for me, it's so important to like feel everything and just let it out.
Really, really good advice. Should we talk about recovery? And know that a lot of people, once they've had their egg collection, they're at the same time as they're recovering, they're also gearing up for, the grand finale of this process, which is the actual embryo transfer. But for those people, that aside, which I know is a huge part, for those people who are going through this and, maybe they're donating their eggs or freezing their eggs, or maybe they're having a frozen embryo transfer, I'd just like to think about how you actually feel in that immediate aftermath, physically and also emotionally. I have heard a lot of people say they had a serious come down after the retrieval. And a lot of people's advice has been do not underestimate the time that you need to recover. How did you both feel, or how have you both felt after your egg collections?
I think physically for the first 2 ones, first 2 egg collections, I felt like pretty much okay straight away. Couple of days and it was fine. Obviously, the most recent one, I knew something was up because I did not feel okay at all. In fact, I felt worse. And it was a few days after where I was, breathless, standing up and going up the stairs that I thought, okay, right, this is not normal. And so then I had to contact the clinic and they got me to go in. I was then diagnosed with OHSS and I had quite a lot of sort of fluid around various organs. And that was not fun. But generally, like the other two, a couple of days and I felt fine. Emotionally, though, and I know some people will disagree with this, but I find the time after egg collection worse than the 2-week wait after a transfer, because you're waiting to hear sort of every other day how many are still going, how many embryos have now dropped off. And I find that such a horrible mindfuck of a time, that for me that's the worst bit. It's almost like the physical side of things doesn't really matter. Like my whole energy is just focused on, okay, but what are our numbers saying now?
How have you coped? Or have you just, as you say, like let yourself feel the emotions and tried to ride the wave?
Yeah, for me, I just tried to ride the wave. I think I'm usually quite good at kind of filling my calendar and planning things, but those days afterwards, I just kind of just write off. And I just know that it doesn't matter what I do, I'm not going to be thinking about anything else. I'm not going to be able to focus on anything else. And I think just kind of allowing myself that time is probably the best way that I do cope, is just to kind of block it off and just be like, this is going to be hard. You're going to cry multiple times a day, whether it's tears of joy or tears of sadness. So don't book anything, because at least just try and be at home when you're getting those phone calls.
I think that it's probably the worst time, because you are, you've had this intense, sometimes 6 weeks with the northisterone and things like that, and getting your cycle ready, and then all of a sudden it stops, and you're not doing anything. Generally, you're not really taking any injections anymore, and I mean, not stimulation injections anyway. So, and lots of things just stop. And then you are, again, you've had that little period of when you've been doing your injections yourself, you've been going into the clinic for scans, and you're seeing someone, you're seeing on the screen that the follicles are growing. And then you're just waiting, you're sitting by your phone every day, waiting for the embryologist to call you to tell you about your embryos. And I think for me, it was slightly different, obviously, because it wasn't me trying to get pregnant, but I remember the relief of waking up when them telling me how many eggs I got, but the fear that nothing would happen and my eggs would be crap, and all this family were waiting on me and I couldn't help them. So I think the whole of like the physical thing, just like get over it. And I felt a bit uncomfortable, but that I probably don't even remember feeling like that, because the emotional side of it was like worrying about this poor family that might not get pregnant because I've got shit eggs. That I think is the worst thing.
It literally sounds like the 2-week wait on steroids.
The worst thing is I have to, I'm going to say it because Annabel knows this, but you will often find that you start off with on day, like the day after the egg collection, they'll be like, right, great, you've had 9 fertilized, for example.
Yeah.
And then by day 3, you might only have 3. So that is like that high, and you're like, why, what's happened? There is no reason for it. They've fertilized, but they haven't divided and continued to culture. So, but that 5-day period, if you like, from day 1 after the egg collection, it is really intense, because you're waiting. It's like on the edge of a cliff to see that how many you're going to end up with.
What level of attrition is normal at that point?
That is a really difficult question.
Really?
Because it depends on a number of factors. So like egg quality, sperm quality, age, how many rounds of treatment. It's hard to answer unless, and I don't want to put figures out there. There are some like averages, but it's taken with a pinch of salt, because everyone is individualized and you'll have an individual success rate, and you can't say what the actual attrition rate is until you know what you've got in front of you.
Yeah.
Like Annabel's had 3 very different experiences, know.
Yeah.
I think for us, it's always, we have generally quite a low fertilization rate. If you forget like the first round, but then our second 2 cycles, low fertilization rate, but then they've generally pretty much all then held on to day 5. Whereas for most people, you have like the higher amount at the beginning and then they drop off. So I do think it's so hard not to compare.
Yeah.
But it's also really, really important to try to not compare and to try and remember that ultimately, like, someone else's experience will have no impact on your results and your experience. Um, and it can be really hard to kind of keep your head just on your embryos and on your eggs. But yeah, you've really got to just try and do that.
I just feel like everything comes back to these two things, which are trust your team and everyone is different. One thing that I've realised we haven't spoken about is constipation.
Mm,
Is that a thing after your egg collection?
yeah, yeah, 100%.
And what can be done apart from drinking your lots and lots of water, which you've told us, Fran?
Well, that is one of the reasons why, because you're dehydrated.
Yeah.
Um, Not much really. You can take some
Okay.
like lactulose and stuff like that, which should help, but it'll come out eventually. Plenty of fluids, lots and lots of like, I mean, just your bowel becomes sluggish. You've had surgery. That's part of the reason as well. Like any
Yeah.
sort of surgery and any sort of anaesthetic will make your bowel sluggish, so you will become a bit constipated. You're also quite fearful because you feel like you've had surgery, and then if you push, that it might do some damage.
Mm.
Um, but I mean, you can get some like over the counter Senna and stuff like that, and you can take it after egg collection, but it will get better eventually, unless you've got OHSS, and then it might last for a few more days. So, which Annabel can probably, she's nodding. So yeah.
It was just very full, the entire area. I don't know whether or not it was bloating or shit or whatever, but
Mm.
it was jam-packed down there, that's for sure.
It's not what you want, really, is it? It's just,
I managed to just get it better in time for Christmas, so that was the one saving grace.
yeah.
Um, it was one to add to, like, the bingo card of IVF and trying to conceive.
Oh, can't wait for that. Before we wrap up, there's one question that I have been wondering and that so many people have asked, which is around how much time to take off work in terms of the day of your collection and the time after. Do you have any advice on how much you would say to take off work?
So again, this comes down to being an individual. I would say that egg collection you can't work anyway because you're going to have sedation. Maybe a couple of days after that, you're going to be in a bit of a hole, if you like, and you're waiting on calls from the clinic. You don't want to be taking them in work and things like that. So if you can take some time off from egg collection onwards for a few days, I think that that's probably best. Some people might want to take the whole time off. You've got to do what's right for you. But I think to stay sane and have things to focus on other than the IVF.
Yeah, I think I'd agree. I mean, the first 2 rounds that we did, I was somewhere where it was like very flexible working. I was only in the office occasionally, and my manager was aware. I think if you feel like you are able to tell your manager, do so, because it makes things so much easier to not have to, while you're thinking about everything else, being able to then say to them, okay, yeah, I'm really sorry. Like, my medication is making me feel this way. I need to have this scan. You're not having to then worry about lying to them as well. So for this most recent one, I wasn't working at all. And that was a very different experience, but actually it was really nice. But I think whether you want to take the time off work or not, my main advice would be to tell your manager, tell your boss. If you are working somewhere that you know you are able to do that, which hopefully you are, then do that.
I'd also say call HR, because we had a fertility policy, and actually just speaking to somebody and understanding exactly what I was entitled to was really helpful. I thought we might end on some positive thoughts from listeners that we've had through about IVF. Someone messaged in and just said, I had a great experience, which I love. And someone else said, by the time we understood that IVF was unavoidable, something shifted. I finally felt I had some control. We had a plan, we had solutions, we had a path. This period was the calmest I've ever been. And they are now 9 weeks pregnant after their second transfer. So that was really nice. Nice to hear. But from both of you, do you have any key advice to anyone who might be starting this process soon?
The one piece of advice that I share is don't be ashamed to speak about it, because if you speak about it, chances are you're going to know someone that's gone through it or will benefit long term for you speaking about it. It might be that down the line they need IVF. Just, don't be ashamed and talk about it.
Love that. Fran, do you have anything you want to add?
Only practical, really, advice is that TikTok and Google are not your doctors.
Really?
You've got a clinic there who are supporting you, ask them. Don't feel like you're a burden. We're here for that. We're here to answer your questions and support you. So if you feel a little bit unwell, or you're not sure about something, or you've forgotten something that we've told you to do, ask the questions. And please don't take medical advice from TikTok or Google or Instagram or anything like that, unless it's someone who is, qualified to give advice. But then again, they're not giving you individualised care. You need to get that from your doctor and your team.
Thank you so much, both of you. Annabel, where can people find more from you if they've loved what they've heard today?
Mainly Instagram. It's at Annabel Gammack. Annabel is Annabel, and Gammack is Gammack, because neither of my names are easy to spell, which is really annoying.
We'll put the link in the show notes. And what about you, Frank?
You can find me on Instagram, and if you did have questions, and I'm more than happy to answer any questions for anyone that anyone's got.
This has been so helpful and really thorough. If you are someone who's embarking on this rocky road, just the most enormous good luck. I really hope that this gives you what you want, and don't compare yourself to anyone else, not even the people on this call.
Yeah, remember that every single thing that you experience, someone else will have experienced that, but you're the only one that is experiencing your, I hate the word, but your journey in this. You're not alone, but also this is your story, and just do what's going to make you feel best during this.
Thank you. I couldn't have said it better.
Thank you for inviting me.
Thanks, Issy, and good luck to you too, because this is a good thing for you.
I'll follow up, and we can do that bingo card that Annabel mentioned and see how many of these applied and maybe how many brand new ones I'm able to add. Thanks, guys.